Thank you. Thank you very much. Okay, thank you very much for not only recognising the work we've done at Wirral University Teaching Hospital, but for listening to me this morning, and is it the afternoon now?
It is afternoon, yeah.
Regarding what we've done at Wirral University Teaching Hospital. Listening into action, can I just ask how many of you are familiar with listening into action? I know many acute trusts and non-acute and other organisations are. So you'll be familiar with what we've been doing. Yeah, okay. Even my colleagues at Wirral University Teaching Hospital are, so that's always a good start. So that's me, Cathy McEwen, Head of Staff Engagement and Organisational Development. I was seconded into this role 3 years ago when we were at an all-time low as an organisation in terms of staff engagement and staff satisfaction. And we'd kind of got stuck at always being in the lower half, if not the bottom 20% of trusts nationally for staff satisfaction. And we really wanted to create some kind of fundamental shift in the way we work and the way in which we engage our staff in change and improvement. Lots of people say, where are you, where's the Wirral? We're just that little blob that's between Liverpool and Chester, and it is the acute hospital that has 5,500 staff, and we serve around 400,000 patients, providing a wide range of services from acute to elective and maternity services as well. Our approach to listening into action and staff engagement was primarily around using listening into action as a methodology, and that is a methodology to bring about change by listening to the workforce, the people who are actually delivering the job on a day-to-day basis, and have a better understanding of what needs to change and improve. We focused around values and behaviours. I'm just giving you some examples today. There's a lot of things we have achieved over the last 3 years. But some of the examples were very much around our values and behaviours. Our communications, because we were kind of always at the bottom in terms of our communications between senior management and staff. Staff never really thought we were doing particularly well there. And our first impressions programme within the trust, and that was very much around the environment. So why staff engagement was important to us? Well, we wanted to ensure that our staff were at the heart of change. It does help us to achieve our priorities and goals. We've heard about Professor Michael West and his research with King's Fund, and that very much is very clear to us that if you get the staff engagement right, all of the other performance indicators and the positive patient experience will fall out of that. But it was also important to give ownership from staff within those clinical areas to improve the patient experience. It does support the quality improvement agenda, and it underpins the NHS constitution around engagement of staff. Some of the quotes there from the NHS Constitution: patient safety, experience and outcomes are all improved when staff are valued, empowered and supported. We encourage and welcome feedback from patients, families, carers, staff and the public. And that's something we hadn't really done particularly well with our staff other than the National Staff Survey, and we work very hard to engage with feedback from our staff on an ongoing basis now. And all staff are empowered to put forward their ideas and suggestions to deliver better services. So our approach was based around what we call the 3 Ps, which is just in terms of today and giving you some feedback today: places, patients and people. So I'll just take you through some of those. In terms of people, we did some work around realigning our values and behaviours. Many NHS organisations will talk about their values and behaviours, but it was very clear to our staff that it wasn't embedded in practice. And many staff, particularly those in non-clinical roles, didn't really understand what it meant if I wasn't at the forefront of patient care. So we had a wide range of colleagues who were involved in rescoping our PROUD values. Our values are under the acronym PROUD. And we engaged patients in that as well. And we had a number of engagement events with staff and with patients. And interestingly enough, and a great relief to us, was that our patients were looking for the same values and behaviours that our staff were looking for as well. So that made it very easy for us. We developed a new trust-wide set of behaviours that underpin our values, because we basically had a set of values, but we didn't say what that meant in practice. We've now done that and communicated that to all of the workforce. We did align those behaviours to the 6 Cs, compassion and care in practice, and really promoting that every interaction is led with our patients is led by those behaviours. And we've integrated those behaviours into all of our HR practices of recruitment, induction, appraisal and performance management. Our staff creative values and behaviours are now also central to our trust's identity, which is proud to care for you. So the values there are patient focus, respect, ownership, unity and dedication, and sitting alongside those were a series of behaviours, and we communicated those out right across the organisation using a variety of communication channels, including electronic communications. That's just an example of some of our proud wall boards, or wall slices as we call them, that are around the organisation with quotes from our staff as to what it means for them, including our non-clinical staff, senior leaders, nursing and medical staff. Some of the other things we did with regard to people was one of our big frustrations for staff was our induction and mandatory training programme, which I often find people say that's familiar to them as well, death by PowerPoint, and so it goes on, you know. And what we did was a fundamental review of our induction and mandatory training programme to ensure that it was safe, but actually review the content, look for overlaps, look for duplication. And that resulted in us putting 3,000 clinical hours back into frontline care as a result of that reduction whilst maintaining safety. Our appraisal compliance, we recognised that it was really important that our staff were appraised, and we had quite low levels of compliance. And that was saying to us, wasn't just about the numbers, it was about the opportunities for the staff, but also ensuring that they had the skills and the competencies to deliver their roles that are planned for at their annual appraisal. So we did a lot of work with our staff, engaged with our staff to see how we could improve the appraisal process, how we could streamline it, and our compliance went up significantly after that. Constantly chase it, but you know, it's work in progress. Making processes work for our teams. We've engaged, our chief executive has very much led this work from the top of the organisation, and has held a number of chief executive-led conversations with staff around what frustrates them, what needs to be done to improve the patient experience, what frustrates our managers on a day-to-day basis. We've had annual conversations each year. And about 1,500 staff have attended those so far. We have had pass it on events where staff have shared their best practice from the improvements that they've made, because a number of work streams have been set up and a number of schemes to help us create improvements for the whole workforce. And they've shared those experiences with the rest of the organisation. Our chief executive is very much committed to the executive team's visibility. We now have a scheme of Trust Board partners that are partnered with every department in the organisation. And we also have a chief executive who actually goes back to the floor, shadowing staff within various areas, departments, clinical or non-clinical, and even served the Christmas dinners on the week leading up to Christmas, yeah. Staff social events, we didn't have anything. We absolutely didn't have anything at all. So we really needed to focus on some of that. So we have done some work with the staff to identify what would be useful for them. So we've set up a choir within the hospital that's quite successful now. I'm thinking about a competition in the region if anyone's interested. And we held a talent event, and we've had various other things, including singing around the organisation. And our communications really were central to this, because our staff recognised that, you know, it's all very well to achieve something in one area, but if you're not actually communicating it to the rest of the organisation, then you may as well have wasted your time. So we put a lot of time and effort and money into our communications plan that supports all of the feeding back to staff what we've done. And we actually sat a group of our clinicians in a room and said to them, what would we need to do to prove to you that this actually works as a way of working? And they said, we need to see the evidence base and we need to be supported to do it. So that was a kind of a message for us, really. In terms of places, just an example here was our emergency department here. And we had a listening into action work stream on urgent care and some of the challenges within urgent care, in particular waiting times. But we also recognised that friends and family was a pretty important indicator to us. So there was, as a result of some of that work, it started some of the improvements within the emergency department. So we had a £2.5 million budget investment into refurbishing the emergency department, and we're now flagged up as having the best friends and family tests in the country. Just thought we'd let you know that. And I did compare last year's to this year's, and we're still the best in the country. Our medical records department, there was major challenges within the medical records department. So we'd had a series of conversations with our chief executive, and these were some of the frustrations coming out for staff, and medical records was an area we needed to address. Storage facilities were really poor. The quality of the storage was really poor, and so there was significant investment around culling records, as well as actually identifying the appropriate environments for medical records storage. And our first impressions programme at Wirral Park Hospital, I'm not sure if you can see some of those pictures there, but our main entrance was looking very tired. And if you're, a patient coming into the hospital, you do get that impression the minute you walk through the door, and it's looking tatty, with the tatty shops and the tatty environment. So there was a fair bit of investment into the Wirral Park Hospital main entrance. And the emergency department, a couple of examples there, it really was a tired looking area, and that was resulting in poor friends and family results. So they're looking much better. One of my colleagues is here for the dementia care team, particularly for patients. One of the key things we did was leading the way in dementia care. And we do have a Listening into Action sponsor group, which is chaired by our chief executive, and his as a sponsor group, they have identified on an annual basis what are the key things, the key challenges we want to address in the coming 12 months. And dementia care was one of them. So opening of the Memories Cafe was a big success for us, and an opening of an older people's short assessment unit. We managed to reduce DNAs in community paediatrics through a review of processes through the engagement of staff. We improved the discharge process, improving discharge rates by 41% through our Ticket Home, Listening into Action work stream, and reducing length of stay in the older person's short stay unit. Staff engagement in the last 12 months has really focused on we needed to shift up those league tables for staff satisfaction. So we had a very strong evidence base that Listening into Action works, and that we needed to do more of it quicker and deeper. So we introduced what we called the 100-day challenge, where we went out to all wards and departments, and that was about 160, 180 wards and departments last year, to actually talk to the staff about what they were most proud of and what were the things that got in their way of them delivering the very best service for them, and what would be the things that needed to improve for them. Over 900 improvement actions identified, most of which have been completed now. Some of them were very small scale, some of them were quite significant improvement actions, but the vast majority required very little investment. We also used Listening into Action to address some of our priorities. So winter planning was one of those biggies for us, and we had our winter plan in place by August, I think it was, of last year, and winter has felt much better this year. Awards and recognition, we've really focused on that. We've really, as an organisation, we were conscious that many other organisations submit for award entries, and we aren't very good at doing that. So we did a lot of that. And we're now middle of the road in terms of staff satisfaction. We recognise we're on a journey. 3.79 was our staff engagement score. For those of you that know what that means we're above average, and the national average actually was at 3.79, but we're in that group that's slightly above the average. Leaders and managers, we've done a lot of work with our leaders and managers because we recognise they were the key to staff engagement, and continuing with the proud communications. So 2016's priorities are sitting there, really trying to engage with our medical staff a lot more, individual recognition schemes, and really addressing the health and wellbeing agenda. Although I have to say, you talked about pizza. We gave them bacon butties, which is what we call it in the north. Bacon butties and sandwiches went down very well with our staff, as well as sweets. We need to think about that under the health and wellbeing agenda. It may not be the best way forward. But really trying to focus on the proud communications, because when we really were quite guilty, I suppose, of not communicating what we've done well. Okay, thank you.
Thank you very much indeed.